We're going to go live and letting everybody in.
Hi, everyone. Can you hear me?
Yes.
My team can. All right, good afternoon. How's everyone doing? Hope everyone's good. I just have a brief update, and then I'm going to hand it over to Dr. Tracy. So in Connecticut, we have over 100 deaths so far, which is obviously a pretty concerning milestone for us to hit. New Haven, the number of cases that we have is 133. That number is pretty close to what we had yesterday, and we're expecting to get more information at some point that we'll likely see that number go up. We had one individual today in our PSAP unit, which is our Public Safety Answering Point call center. It's basically our 911 call center that had called in and tested positive. That individual hasn't been in for quite some time, and it's unclear where the individual contracted COVID-19. The team quickly cleaned the facility, and we're very grateful to Hamden, who we relied on through mutual aid to cover the 911 calls that came to the city of New Haven during the time today when they cleaned the facility. Really good news about our medical reserve corps. We had 19 individuals go through a class today, and they're ready to go, including my downstairs neighbor. What do you know? And in particular, grateful to Rick Fontana and Maritza Bond for setting that up and training folks today. It's exciting to see so many people willing to help out and contribute at this time that so many people in the community need it. And finally, I just wanted to make a note to thank restaurants and bars out there. I got a great email from the owner of JP Dempsey's, who I think is exemplary of many of the actions that we've seen from people in the community that own small businesses, that they understand we're going through really tough times, but are stepping up to it and ready to hit the ground running once we can open up again. And JP Dempsey's said that the first beer's on us when they open up again. So I'm looking to take them up on that offer. So with that, maybe I'll hand it over to Dr. Tracy. I think you had some updates to share.
Okay, thank you very much, Mayor, and good evening, everyone. On the education side, things seem to be moving fairly well. We have our little bumps here and there in the way, in that we still have some challenges in getting Chromebooks to some of our families. We are working on that through Dr. Paul White and Ms. Keisha Hannans, my able assistants. But I have some good news to share. I have been in touch with a former class of my daughter's former classmate who has reached out and is willing to make some great donations to New Haven Public School students. And without any further ado, let me turn it over to our philanthropist, Jeff Weber.
Dr. Tracy, that's very kind of you. Hello, New Haven. Before I get to my prepared remarks, I just want to let you know that your elected officials are really awesome. I reached out to a number of local governments recently, and none were as responsive and well-run and eager to create good news as New Haven. So please don't blame them for coronavirus. They are working insanely hard to make this bad situation better for you. It is very cool for me to be here. I'm just a regular citizen. My name is Jeff Weber. I grew up in Cheshire. I live in Westport now, and I'm proud to be donating $50,000 to New Haven Public Schools today. This will put 200 Chromebooks into children's hands. That's pretty cool. Probably the coolest thing I've ever done, besides have my sons, Jeffrey and Jack. Now, while the $50,000 check I've written says Jeff Weber on it, I am making this donation in honor of Hedgeye, a Stanford-based investment advisory for regular people that taught me how to make money investing. Check them out and tell them Jeff Weber sent you. They will take care of you. They are good guys from Yale. I also want to take a moment to alert 2 Connecticut residents that happen to be my financial market heroes of the charitable opportunity of a lifetime. Right now, with $6 to $10 million, we can put Chromebooks in the hands of every student in New Haven. Another $6 to $10 million takes care of Bridgeport. There's also Norwalk and Stamford and Meriden and Hartford too. All of Connecticut's cities urgently need Chromebooks. In a wealthy town like Westport, education is continuing online. My kids learn today. But in New Haven and Bridgeport and other cities, learning has come to a standstill. Every day that passes is a day where learning opportunities are lost. So I am here to implore investing legends and Connecticut luminaries, Mr. Ray Dalio and Mr. Paul Tudor Jones, to shine their charitable lights on these fine cities today. These gentlemen are among the most heroically charitable people in the world, and I know this is a golden opportunity for them and for all the children who need to pass social distancing time learning online. And while Connecticut is dearest to me, I'm sure there are kids in Seattle who could use some laptops from Jeff Bezos. And Elon Musk, bro, I love you, man, and my kids idolize you. But Elon, dude, there are plenty of kids in California that can use laptops to prepare for trips to Mars. The world's crazy rich geniuses need to make learning happen yesterday for these kids. Elon could solve this problem with a tweet and a couple of phone calls. And I would be remiss if I failed to credit Nikki Fleury and her mother, New Haven Superintendent Dr. Eileen Tracy, for making this donation happy. Nikki and I connected on Facebook a few weeks ago, and it was her passion and concern for the children of New Haven that truly inspired me. Thank you, Nikki and Dr. Tracy. You guys are my heroes. With that, I want to thank you all for your kind attention. I truly believe great charitable men like Ray Dalio and Paul Tudor Jones and Elon Musk and Jeff Bezos are the only heroes who could help us right now. And when this tempestuous storm passes, many jobs will be created building statues in schools across Connecticut for these amazing heroes. Thank you all for your attention. Please stay safe and well. And I say this with tremendous seriousness. Baba Booey, Baba Booey, Baba Booey. Have a great evening, and please smile and hug your loved ones. And if you need a friend, find me on Facebook. We all need to be friends with strangers today. Thank you and have a good evening.
Thank you very much, Jeff. Thank you so much. And I'll turn it over back to our mayor, Mayor Elicker.
Thank you, Jeffrey, for your very generous contribution to New Haven Public School students. The Community Foundation of New Haven has been very willing to facilitate the donation and process that. And so we're also very grateful to them for stepping up really quickly to make sure that the donation can be put to action very quickly. With that, maybe I'll open up to questions. Okay, I see Paul has a question, and then I'll go with Kyle.
Okay. I try to not raise my hand right away because I don't feel like I always need to ask the first question.
Everyone's even more shy than you are.
Okay. Justin, I wanted to read you a short question someone posted on the story about yesterday's briefing, seeking an answer. Do we have any idea how those people at Bella Vista got COVID? Was it other residents, or was it because they were outside and brought it like they went to a store or something? I'm getting increasingly worried about my father who lives there and tells me the residents there are still walking around the hallways and going to other apartments to hang out.
Director Bond, do you want to answer this, or do you want me to take a stab at it? I mean, I will just say I don't know as far as how they contracted it. So I don't know if you want to add anything. You're on mute.
Oh, there I am. I'm unmuted now. So hi, Paul. Thank you for your question. I think that's a good concern. When we do contact tracing, sometimes the exposure is unknown. It could be from just going outside. Because we are in community transmission at this point, anytime that each of us go outside, we have put ourselves at risk. And it could be from a variety of things. And so when we conduct our contact tracing, anyone that's at risk is contacted that had any prolonged exposure to that positive case. So we will look into that comment, and I will and see that comment online.
Thank you. So I just wonder, I mean, because you had mentioned this, Justin, the other day about your concerns at Bella Vista, that you thought that they're having a little trouble enforcing these rules and not visiting each other. So I guess this guy's concern is that that might still be happening.
Yeah, so I think as far as where the individuals contracted the virus, I don't have a good answer to that, but I do think it's important for residents to call our health department or at 203-946-4949 or call Carabetta if they have concerns that their neighbors are not practicing social distancing. That's something really important to know, and having been to Bella Vista many, many times, it may be that there's some activity on one floor that the staff doesn't know about because there's many buildings and a lot of people living there. We found that in general, Carabetta has been cooperative and very interested in being proactive to promote social distancing and try to do everything they can to prevent individuals from interacting a lot. But it's helpful for us to hear, similar to the parks, from the public when their neighbors may not be practicing that, so we can just remind people to do so.
Thanks, Justin.
Yep.
And
I
I
saw
also want
Kyle.
to
Go ahead, Marissa.
I just wanted to add that at Bella Vista, the Fairhaven Community Health Center has also expanded their telemedicine efforts so that they can provide care to individuals and they don't have to leave their homes. And so that information has gone out to each of the tenants as well to reduce their risk to exposure in the community.
I saw Kyle and then I saw Michael Bingham after that. Go ahead.
So, thank you. I have a question about the Chromebooks. I know this is for Dr. Tracy and Jeff. So, Dr. Tracy, you mentioned that you have tried to hand out as many Chromebooks as you could, or almost all the students. Could you go over how many have been handed out, how many are left, and how the students will be impacted by the additional 200?
So, okay, thank you for asking that question. So far, we have handed out to date over 7,000 Chromebooks to our students. And we still have a lot more to go, we believe, but we are waiting to see as soon as students log on into their Google Classrooms and attendance is taken that way, we're taking attendance basically to find out how many are engaging. As the principals see those things, then they're going to track and let us know how many students are not engaged. That will help us to know maybe they're not engaged because they don't have a Chromebook. And so the principals and teachers are following up with the school, with the students, along with youth, family, community engagement folks, following up to see why is it that you have not logged on. So that's the method we're using right now.
Okay.
Yeah.
And how are they picking them up? Are they able to go to the schools and?
No, the schools are currently off limits for all educators right now, and only our first line workers who are there because of food distribution still going on right now. So we are planning, my team and I are planning a way to figure out how to distribute these when they do come to us. Because we also have some of them that will be coming from the State Department, sometimes early May or somewhere around that, for basically high school students. We'll figure it out. We put our brains together and we'll figure it out how to get it to parents and ensure that social distancing is practiced.
Okay.
I'm trying to unmute you, Michael. Can
you hear me?
There you go.
Oh, good
Yes.
afternoon. Mr. Weber, I had a question. We all applaud your generosity, but I was unclear about, was the $50,000 from you personally, or you mentioned Ray Dalio? Was it from both of you or from him? I was unclear about that.
No, first, I apologize for smoking. I thought I was off camera, and that's the first time my kids will ever see me smoke. I just, I'm not used to that.
It's safe with us.
Well, my mom is going to see this, so I'm not safe. Anyhow, the money came from my bank account, but I did it in honor of this company, Hedgeye, who are these guys from Yale that taught me how to make money in markets. The reason I brought up Mr. Dalio and Mr. Tudor Jones is that they're some of the most generous people in the world. Mr. Dalio has pledged to give away more than half of his fortune. Mr. Tudor Jones has raised hundreds of millions of dollars annually for his Robin Hood Foundation in New York. So these guys love to give, But, you've seen the markets recently. They're kind of busy. And, they're not on Facebook connecting with Dr. Tracy's daughter, like I am. So, I wanted to just get the ball rolling. And, and I think this $50,000 buys some attention. And I think it will allow us to, if those guys don't come in, they have plenty of friends. And somebody is going to see this and want to give us this money. And one thing I want to point out that came up in my discussions is that each child needs a laptop. We can't send one to one household with 3 kids. That won't work. So this is a really complicated problem. And if we can cut through the red tape and, infuse the cash directly, we could get these laptops out in a matter of weeks and we won't, miss the rest of this year. So, there's an urgency to this and that can only be done with private funding.
So Mr. Dalio and Mr. Tudor Jones are examples and inspirations. You're not actually working in partnership with them.
No, not at all. If I had their phone numbers, I would have called them. But, I'm really not anybody. I'm just a dude on a webcam.
Thank you for the clarification. Thank you.
Go ahead, Shana.
Thanks, Mayor. Just one more follow-up for Dr. Tracy. As far as you know, with the concern with getting the number of Chromebooks to students, there's a concern that many students at home may not have the most supportive environment as far as attention goes and getting the individualized attention they need to complete tasks and assignments. I'm wondering how your teachers are going about grading them given the circumstance that many students may find themselves in. Is there a leeway, or is there another way you guys are kind of monitoring and grading students given the circumstance?
So thanks for the question. So using the state of Connecticut's guideline, message we have to teachers is this: we are providing educational opportunities for all our students. This is actually supplemental work. It is not just like school. This is an anomaly that we are faced with right now. We are asking them to make sure that they give feedback to our students as they do the work. Feedback does not necessarily mean a grade, but give students feedback. Tell them they're doing a great job. Tell them, give them some more examples of how to probably solve a problem. Those types of feedback until we get further clarity from the State Department of Education what needs to happen. I hope that answers your question.
Yes, thank you. I have one more question for Mr. Mayor. Yeah, I don't know if I can just grab you.
Sure, go for it.
So tonight there's, I'm sure you're aware, Board of Alders meeting, and from what I understand, they're set to discuss a series of legislative items related to the pandemic and the extreme circumstances that the city finds themselves in. Do you have any idea as far as basically my question is, how is your communication been with the Board of Alders and working together as a collaborative effort to gauge this pandemic? If you can kind of talk about that.
It's been very good, in my opinion. I have a daily call with the president of the Board of Alders, and then a second call with Board of Alders leadership. I think that helps facilitate any questions that they may have and notifies them of a lot of changes. The Board of Alders are oftentimes the most significant voice in the community, and allowing us to communicate messages to individuals out there, and in particular right now, because of such a need to communicate in a fast-changing situation, and the importance of everyone in the community complying with a lot of the requests that we're giving. That line of communication with the Board of Alders and our cooperation, joint cooperation, is pretty critical.
Gotcha. And they mentioned, I know there's an idea of talking about, following the social distancing rules, like kind of like the orders that you guys have given at the city level, and also saluting the frontline workers that have been at the forefront of the pandemic. And there's an idea, or there's talks about supporting those that are facing hurdles that may delay relief. Can you talk about what that looks like, or what the conversation has been about that.
I'm not exactly sure what you mean. You're talking about for those individuals that may have lost their jobs in the community or may not have access to a lot of resources.
Exactly. Yeah.
So our team is spending a lot of time in particular on that issue. And we think that it's going to become increasingly challenging for people that in particular are unemployed, that were previously employed, but don't necessarily have the access to some of the resources that are coming from the federal government. And one community that I'm particularly concerned about is the undocumented community. So we're having conversations about how to support the undocumented community. One thing to note is that as far as medical care goes, the access that anyone has in New Haven is the same to our health department, to the support we give to make sure that people are getting safe treatment around COVID-19. And I think that's something that's critical for us to continue to underscore. But on the economic side, we will be having conversations about how to make sure that, in particular, the undocumented community has the support that they need to get through this time.
All right. Mayor, thank you so much. And Dr. Tracy, thank you as well.
You're welcome. Thanks.
I see Mackenzie has her hand up. Where are you, Mackenzie? Oh, you're in a different. Here. Okay, go ahead, Mackenzie.
Thanks so much. Had a few questions about updates for the homeless population. One, you mentioned yesterday that the Medical Reserve Corps was going to help the career site to open soon. I'm wondering if today's training means that the site will be opening in the next few days. And then I just wanted to follow up on my question from yesterday about hotel rooms and whether all the homeless shelters in the city are actually closed right now, or if you have an expected date for when they all will be closed, and when they're closed, how homeless individuals can connect with hotel room services.
I'm not trying to avoid your question. I don't have good updates, unfortunately. We're inching closer on both of those issues, but we're not quite there yet.
All right, thanks so much.
Yeah. Okay, I see Paul.
Thank you again, Justin. You mentioned the Medical Reserve Corps, which sounds very cool. What are some very, very specific tasks these people will do? Because I don't know if this means like taking people's blood pressure or transporting them to the hospital or shopping for them or working with people who aren't in ICU but need some kind of medical attention. Who exactly are, not names, but who are these people and what are they going to do?
Director Bond, do you mind answering that?
Hi, Paul. So the Medical Reserve Corps are healthcare professionals that sign up to volunteer throughout Connecticut. Specifically, these Medical Reserve Corps have volunteered to support our efforts, and it's going to be in a number of ways. That's going to consist of checking temperatures, screening individuals, doing well checkups with individuals, just having conversations and screening them daily just to check symptoms, things that would be normal triage as if you will go to the doctors and get screened and ask daily questions about your symptoms. So they'll be doing basic medical follow-up and triage within the population that we're looking to serve.
Are these nurses, are these doctors, are they working with the city health department for responding to people who call you and say, I think I have COVID or I have COVID, but I'm not in the hospital?
So we're looking to activate, our Medical Reserve Corps go through a process, and it is through our Medical Reserve Corps region, MRC regional efforts. And they specifically pick a mission to support us for specific tasks. And so what we're going to be gearing them up for is for our Shelter 1 in the future when we activate. And so we are aiming to activate them soon and prepare them to respond to our shelter needs.
So meaning the career high?
Correct.
Is that the shelter? So are these nurses, are they doctors, are they PAs?
There's a variety of healthcare professions, and there's also residents that are laypersons that also registered. So there's a combination of both.
But I mean, were they nurses? Doctors?
Mostly nurses. and some laypersons that just have general, backgrounds around case management and layperson skills.
Thank you.
Just one other thing, Paul, that so we are working to have some doctors that are going to be available for consultation. And it's helpful to have someone that understands medical language and that can communicate with doctors if a question comes up that we need an outside opinion to potentially make a call that if someone might be sick enough, we might transport them to the hospital, something along those lines. So
Is
another
that
role.
part of the medical reserve? Is there doctors who are part of this?
So my understanding is the doctors have not signed up through the medical reserve that will be on call. But we have separately some doctors that have agreed to be on call if there are medical questions that come up that we need that kind of expertise for.
Correct.
Thank you.
And a behavioral practitioner as well.
I'm getting a shrink. Okay.
A behavioral practitioner.
Oh, okay.
Go ahead, Mary.
I guess I have same questions along what Paul was talking about. When you describe the shelter that will open a career, you said there will be 3 nurses that really will be staffing it, a doctor on call 24 hours a day. So that these people coming in from the medical corps, are they going to the hotels where people are? Is that where they're going to be checking on those people for health updates?
We did not specify the number, so I just want to clarify that neither the mayor or myself specified any number of staffing. The individuals that are going to be activated through the Medical Reserve Corps are going to be activated to support our Shelter 1 once we're prepared to do so. And they'll serve in a number of roles. And once we are prepared to launch it officially, we will make a full announcement of the scope of services that will be rendered with our MRC volunteers.
All right. I was already told it was 3 nurses that will be essentially staffing.
Yeah, that might have been my mistake, Mary. I'm not on the daily calls with the team that's organizing the details on this, so they're working out the number of individuals that are going to be staffing it.
All
right.
So sorry about that.
But
we'll
it
make
is
sure
really
to
good
update you, Mary.
I'm sorry.
We'll make sure to update you when the time is right.
All right, and are you looking for the staff for that facility? Is that what the holdup is to actually, and also, I mean, do you have any individuals or patients that might actually qualify to go there?
We're actually finalizing the logistics now. There's a team of us that are working on a number of different pieces to ensure that we execute this effectively and efficiently. And so once we're prepared to launch it, we will provide further details.
All right. At the beginning of the call, you were talking about, was it a person in a shelter who now has COVID? I wasn't quite sure.
No, so an individual, the city employee that works in PSAP, the 911 call center,
Okay.
has been out for a while, but notified us today that they tested positive for COVID-19. And so, and that notification came in this morning. They quickly cleaned the facility, and during the time that they were cleaning, they transferred 911 calls to Hamden and activated through the mutual aid activation, and now it's back to normal.
Okay. Do you know if any individuals in the shelter or homeless people have contracted COVID? If they're in the hospital or they're just being monitored somewhere?
At this moment, we don't have any additional homeless individuals than what we reported earlier on in our press conferences.
Okay. And I know the individual who left the hospital and went to Milford, but were there more than that?
Not at this time. I am working closely with the hospital that we are going to be able to collaborate and establish a protocol for those that are in need of care after being tested positive in the emergency room or inpatient services. So we will be working closely together on that.
All right. But so far, there aren't individuals that are homeless that are reporting in, or people are reporting them in?
Not at the moment.
All right. I guess I'll stop after this, but I'm still confused about the medical corps people and where they will go. I mean, you'll have people in hotels, some who may have COVID, some may be exposed. I'm just wondering if they're going to be.
I think there's a couple things going on. So there were 19 people that went through the training. People have to go through shifts, right? So we can't expect just a few of those people to work 24 hours a day nonstop. So we need a lot of people to staff one facility, even though they may not all be working at the same time. The second component of this is that there's a lot of moving parts here, and we're working as fast as we can to determine what types of facilities we do need for different individuals, while the state at the same time is doing something similar. And so, as of a week ago, we did not know that the state, and the state may not have known this either, was standing up the site at Southern. And so as different sites get created, it changes some of our assessment of the needs changes. It may change some of our plans. So it's helpful for us to have a variety of different skilled people. To use your example, Mary, we have fewer individuals that are experiencing homelessness that get sick. We want to be prepared for a lot of people, but should we have fewer, we may have a lot more people that need housing and or need a site because they live in a small unit with multiple people and they don't want to get other people sick in their homes. And so we need flexibility with how we move around staff. And so while we may not have a specific plan for everyone, it's helpful for us to have a lot of people in their medical reserve corps that are ready to activate in different ways. You still look unsatisfied.
Mary, we'll give you a full plan when we're ready.
I know you will. Absolutely. I know that's guaranteed. Just talking to the state people today, I mean, basically they said New Haven is looking at 2 hotel sites, and trying, maybe one of them will be the entire site. That wasn't clear. I mean, to separate people, would you just have different floors with people that are sick and some people that are exposed but not sick?
At this point, the goal is that the hotels will be used to house homeless individuals that are asymptomatic.
So there's other categories. You'll still have to figure that out.
That's one thing that we're actively working on.
Yeah.
Thank you.
Other questions? Other questions? All right. Thanks so much, everyone. We'll see you soon.
Okay.